Today I'll be discussing Chapter 8 in your book, which is all about hormones. We will talk about some terms and abbreviations. We'll also talk about the endocrine system and some of the major structures that are included in that. We'll also talk about some of the hormones that are important to you guys in surgery. And again, we'll go over some different structures and uses for the hormones that they produce. So first up, when we're talking about hormones, these are chemicals released by the endocrine glands into the bloodstream. We talk about these in the surgical setting because some hormones are used in surgery, so they may be given from the sterile back table during a surgical procedure. Each hormone is going to have a specific function at a specific location in the body. Some of the things they can do are maintain homeostasis, and they also regulate functions like reproduction, growth and development, and metabolism. You can see the picture here where it talks about some of the major endocrine glands. Also remember that some hormones, actually most hormones, are going to be administered as replacement therapy more in the medical setting, not necessarily surgical. So there's going to be a lot of hormones that are used that you won't see specifically given in surgery. So the endocrine system communicates by sending chemical messengers, which are hormones, to target cells that are located all over the body. The hormonal effects can be categorized in a couple different ways. They regulate internal chemical balance and volume. Can also be categorized by the response to environmental changes like stress, trauma, and temperature changes, growth and development, and reproduction. If you look in your textbook, you'll also see figure 8.1 that's going to show the endocrine system in your textbook. So again, just remember that the endocrine system works in conjunction with the nervous system to send these messages and maintain homeostasis in the body. So endocrine system review, we're going to start off and remind you that steroid hormones can be classified as a couple different things, either glucocorticoids, mineral corticoids, estrogens, progestins, and androgens. And a little review, androgens are male sex hormones. The non-steroid hormones are going to be synthesized from amino acids. These include epinephrine, norepinephrine, threonine, and triiodothyronine. The vast majority of endocrine disorders are going to be due either to hyposecretion or not enough secretion of hormones, or hypersecretion, which means too many hormones are being secreted. First, we're going to talk about the pituitary gland. So this is called the master gland of the body, and it's going to be vital to reproduction and growth. It produces a hormone that's going to be particularly important to you guys in the surgical setting, which is oxytocin or pitocin. This is what will stimulate the uterine contractions needed for labor. It's also going to be used in C-sections when the natural contractions after birth that we need to stop postpartum bleeding aren't strong enough. They can do pitocin drips on these patients to help the uterus to contract down to help with that bleeding. So this is something, some departments, you'll see they have their own labor and delivery department, which employ surg techs. Also, sometimes in the operating room as a whole, they'll be doing C-sections there. So it just depends which area your hospital does these cases at, whether or not you'll see these particular hormones in use. You want to be really careful though with pitocin. You don't want to confuse this with pitressin, which is a vasopressin. So this pitressin is going to be used to stabilize fluid balance in patients with diabetes insipidus. So just really careful again to read drug labels and make sure you're not getting anything mixed up. The largest endocrine gland is going to be the thyroid gland. This is going to consist of two lobes joined by an isthmus in between. With this will produce hormones that treat underactive thyroid, or hypothyroidism is another term for that. Thyroid hormones can be either natural or synthetic. They're not going to have any direct surgical application, but they're going to instead support the preoperative patient health. Um, the thyroid gland secretes three important hormones, T4, T3, and calcitonin. And when we're talking about thyroid gland, we want to have euthyroid. This just means that the gland is normally functioning. If anything is out of whack with hormones of this, it can cause a thyroid storm in the patient later, which can be very serious and even cause death. So we just want to make sure that they have a good balance of those hormones. Parathyroid glands. These are usually found embedded on the back or posterior surface of the thyroid gland. They're small, yellowish brown ovals, and usually they are covered with some adipose tissue. Just like the thyroid, the hormones produced by the parathyroid don't have surgical use, but instead they're going to be used for hormone replacement. They produce PTH, or parathyroid hormone, which is going to monitor circulating concentrations of calcium ions in the blood. So you may have issues if they're over or under functioning parathyroid glands. You can either get too much or too little calcium in the blood, which can cause a lot of different problems throughout the body. The adrenal glands are found on top of each kidney. These are going to be pyramid shaped. They're highly vascular, and the adrenals have a central portion called the medulla, and the outer portion is called the cortex. These adrenal glands will produce, store, and secrete the hormones epinephrine and norepinephrine. Epinephrine, you'll see this used in surgery. It can be used topically for hemostasis, and we talk about this a lot. We've already talked a lot about the different concentrations of epinephrine. It's often used in the surgical setting to prolong anesthesia when combined with an anesthetic agent. In dilute amounts, it causes local vasoconstriction, which means it causes those blood vessels to shrink down, get smaller, and then it helps to hold that anesthetic agent in that area longer. So the bloodstream, since those vessels are smaller, they don't move it out and diffuse it as quickly, so you get a prolonged effect for that anesthesia pain control. In middle ear procedures, you can use a concentrated epinephrine. It'll be applied to areas of capillary bleeding, and this will just help the doctor when they're working. You can see here the two pictures. The one in the vial is that concentrated epinephrine that you might use just on the middle ear. And then on the one picture on the right, it is lidocaine 1% with epinephrine, and that is a concentration of 1 to 100,000. That's what you're going to see when it's mixed with local anesthetics. Another name for epinephrine is adrenaline. That's going to be the brand name. And just keep in mind, in ear surgery, you're only going to use this for topical application. You're never going to use that high amount for an injection. There is a second part of the adrenal called the adrenal cortex. So hormones from the adrenal cortex will fall into two major groups, either glucocorticoids and mineralocorticoids. Together, these are known as steroids. So of the two groups of hormones, the glucocorticoids are more surgically significant because they do help to reduce or inhibit the inflammatory response after surgical procedures, for example, like a shoulder arthroscopy. They also can be used medically to help prevent the rejection of donated organs. They do treat autoimmune disorders. And then even during and after surgery, they can treat bursitis, synovitis, and epicondylitis. Of the mineral corticoids, the most important one is aldosterone, which we'll mention here in a little bit. Steroids may be administered either topically, orally, IM, which is intramuscularly, or rarely through an IV. Depending on which agent is given, they're either long or short acting. And when these are given for diseases like arthritis, steroids are going to be palliatives. If you think back to maybe midterm or just other experience you've had, palliative means they relieve symptoms. They're going to make the person feel better, but it doesn't actually cure the condition or disease. A lot of time you're going to hear this term used like for cancer patients. These glucocorticoids, they can be injected during surgery as needed and an arthroscopy, again, to help with that inflammation post-surgery, as well as cataract extractions so the eye doesn't have a lot of inflammation after the surgery is over as well. The pancreas is another endocrine gland. It's going to be divided into three anatomical structures or areas: the head, the body, and the tail. So you can see this picture here where it kind of sits kind of curled up in the small intestine underneath the liver, but it's going to kind of hide behind the stomach. So it's not easily seen from the abdomen. It's unique because it does function as an exocrine gland for digestion and an endocrine gland for hormone release. It releases insulin and glucagon. So these both help to regulate the metabolism of glucose, which is a simple sugar used as an energy source. It is effective as far as the hormones it produces, but neither of these are going to have direct surgical use. The ovaries are going to be paired glands that produce estrogen and progesterone. They're both critical to the development of female sex characteristics. A lot of times these hormones are going to be used as hormone replacement therapy after menopause. They can also be used for palliative treatment of advanced prostate and metastatic breast cancers. Occasionally you will see this used in surgery as well. So sometimes we'll use this as a packing after a vaginal hysterectomy. So what they do is they have this gauze type material that's on a roll. So you kind of roll out a long piece and then back on itself repeatedly. And then you take like a tongue depressor to put this cream and put it on there, and then they'd be able to pack it in the vagina during surgery, and then they take it out. Basically, it's like a dressing that they would take out later. Also, you can see here the picture of the ovaries, how they're related to everything else. You can look in your book too at figure 8.6 too if you want to see normal anatomy of the female pelvis. And then the last gland we're going to talk about are the testes. These are paired glands that are located in the scrotum. Androgens are going to be the male sex hormones produced by these. So these, especially testosterone, are administered as replacement therapy when indicated. They can help treat hypogonadism, and sometimes they can actually treat some types of advanced breast cancer in females. The androgen danazol is used to treat such diseases in females as endometriosis and fibrocystic disease of the breast. Sometimes this will also be used in females that are going to have an endometrial ablation done. So what this does when they have an ablation done, it essentially is taking a special tool into the uterus, and it's going to kind of help to burn the lining. So maybe somebody's having very heavy periods. They can use this to kind of reduce that endometrial layer. So what they'll do is they'll use that danazol ahead of time, and this in itself also helps to reduce the volume of the endometrial layer. So then they go in and burn, and it's going to be more effective. Otherwise, outside of this, androgens are not going to have any surgical use. We will talk in class this week specifically about a couple different hormones that'll be important to you to know in surgery. I kind of mentioned them here, but we'll hit the high points. And if you guys have any questions, please write them down and let me know.